Folks, Paul Ryan and the Republicans had a rough couple of days. Now, I did a video yesterday regarding a rookie, Devin Nunes, trying to, I guess, cover Trump ass and it backfiring. If you're not aware of it, Devin Nunes went to President Trump with some information that he had gotten from a quote-unquote anonymous source. And we all know how much the Republicans and Donald Trump love to get all over anonymous sources. But in this particular case, they had no problem with it. But with that being said, Mr. Nunes violated all protocol for the Intelligence Committee, of which he is a chairman. But there was one person yesterday that got cover, and I'm not talking about President Trump. It's this guy right here. Mr. Nunes, being a rookie, and I guess not really familiar with the proper protocols, and honestly, I don't believe that. I just believe that he wanted to get some cover for himself, which he ended up not getting. Mr. Nunes apparently received whatever information that he received and went to Paul Ryan and discussed that information with him. And apparently it was Mr. Ryan that gave him the permission to take that information directly to the president without informing either the ranking member of his committee or any of his committee members. And like a good soldier, Mr. Nunes fell on his own sword and didn't mention Paul Ryan when he was apologizing this morning to both his committee members and when he gave a very brief press conference regarding the matter. But he did acknowledge that he screwed up. I don't really think it was a screw up. I think that since he was a member of the Trump transition team, which obviously is under investigation by the FBI, I think that he was looking to try to help Trump circle the wagons. But that's just my opinion. But honestly, you know, a rookie would not have made that mistake as far as letting the person who is under investigation know the information that an insider at the FBI has provided you with. You just don't do that if you're trying to stay above board. But anyway, Mr. Ryan ducked that particular problem, but he didn't and is not going to duck this one. That American Health Care Act that they put together is, in my opinion, not going anywhere. And it's honestly not because of the Democrats. There are approximately 50 Republicans, and I do mean right-wing Republicans, that are not going to fall in line with this bill. Well, anyway, there's a group of 50, of which approximately 30 have indicated that they aren't going to fall in line. And Mr. Ryan has been given his marching orders to bring that bill to the floor tomorrow. Here's a clip of him making his statements. And notice, he did not say that he is going to pass that bill tomorrow. He says that he is just going to bring that bill to a vote, which to me indicates no confidence whatsoever. Here we go with his brief comment.
7.5 years, we have been promising the American people that we will repeal and replace this broken law because it's collapsing and it's failing families. And tomorrow we're proceeding.
Now, the people that you're going to see coming into the door, if you can make them out, the person that's on the right with the red tie, that's Rance Priebus. The person on his right with the glasses on the other side of the gentleman with his back to you, that's Steve Bannon. You can't quite see Kellyanne Conway, but she'll be in the clip. Trump sent his lackeys to meet with the GOP caucus to try to twist some arms. And he basically threatened them even more so today than he did yesterday. And in my opinion, those guys that have made it clear that they're going to vote no on this are not afraid of Donald Trump at this point. The reason they're not afraid, because these guys are the righties of the right. And if anybody tries to get right of them, they'll probably somewhere in the Atlantic Ocean. Anyway, here's the visual clip so that you can see Priebus, Bannon, and Conway walking in to the building that houses the House of Representatives. Yep, there's Priebus. There's Kellyanne Conway, and Bannon was he was out there as well. Anyway, there's Mr. Trump. He had a meeting with the truckers, and he's already backpedaling. He told the truckers that if the bill doesn't pass, it's not because it's a bad bill, which it is, but not in his opinion, but because of politics. But this is Mr. Art of the Deal. He's supposed to be able to broker deals and pull rabbits out of hats. But apparently, that particular skill has disappeared. Now, folks, we're going to have a problem because he's losing on his ban on those 6 countries in the Middle East and portion of Africa. He's losing, or is going to lose, on this American Health Care Act. He's losing everywhere, and Donald Trump doesn't take losing lightly. So he's got to look for a place to find a win. And I'm scared to death that that place that he's looking for to find a win is going to be North Korea. But I've already done a video about that, so I'm going to leave that right there. But I want you to check out 2 Republicans, one of which is going to vote for the bill, and the other of which is going to vote against it. But I want you to pay special attention to the gentleman that is going to vote for the bill, and listen to the reasons why he's going to vote for the bill. Hang on one sec. All right, the Republican you see in front of you is a Republican out of New York, Chris Collins. And he's from downstate New York City. This guy is a Trumper. He is in Donald Trump's pocket. Now, Brian Williams is obviously going to interview him, but I want you to listen to the reasons why he's going to vote for the bill.
U.S. Congressman Chris Collins is a Republican from state of New York and was famously the first in Congress to announce his support for then candidate Donald Trump. Congressman, I didn't want to ask Kelly O'Donnell for a prediction, but that doesn't stop me from asking you. Do you think you have the votes for this thing up or down tomorrow?
Yeah, Brian, I'd say the answer is yes, and I agree with the president. It's time to call the vote. If we push it further right, we lose votes on the left. If we push it further left, we lose votes on the right. This is what we have, and at this point in time, it's a vote to support our president and all of our signature issue, or frankly, it's a vote for Nancy Pelosi in maintaining Obamacare, which is failing and will even get worse as we move forward. So this is something America needs, a yes vote tomorrow. People are going to have to understand they're going to go home, and on those red Republican districts, it would be very hard to say they did not support the president, who in some cases carried their districts with 60 and 70%. So that's why I'm an optimistic yes on this tomorrow, because it is the binary choice, up or down. The president's right. Let's get it done 2, 3 o'clock tomorrow afternoon. I think it's a yes.
Now, folks, if you were paying attention, he did not say that he is supporting this particular bill for the good of the people of his own district, for the people of the state of New York, or for the people of this country. He said he was supporting this bill because he was supporting his president. Now, I always thought that when you're elected to represent your constituents. And when your constituents are not following in lockstep with the president, you basically need to honor what they want you to do. And especially in New York, he knows damn well that the people in his particular district are not for this particular bill. But that doesn't mean a thing to him because he's a Trumper, okay? So Donald Trump says jump, and he basically says how high.
And you handily won re-election in your district, but you've got people living in poverty in your district as well. The president is polling at 37% popularity. The only thing worse right now is the popularity of this health care bill, and that is at 17%. Are you prepared during the Easter break and several Easter breaks to come to hear from your constituents, some of whom may be dropped from health care?
Well, because, Brian, I don't believe that's the case, and certainly over the next 2 years. This is what seems to be missing. We're not making any fundamental changes until 2020 because...
Okay, let me stop him right there. I don't know if he knows what the hell's going on, but I damn sure do. What they traded to try to get some more of the... I don't know what, there's a name for the group of the 50 guys. I really honestly don't remember what it is. But what they traded in order to get some of those guys to come on board was to accelerate the block granting of Medicare to the states. So instead of them actually trying to wait until 2020, they are looking to accelerate it into 2018, okay? And they are also looking at removing the taxes or the tax revenues associated with helping to fund the plan. They're looking at moving the removal of those taxes by 2018 as well. So when he starts talking about 2020, he needs to turn around and read the updates, because I damn sure did.
We need a long glide path for the insurance companies to get together, for the states, their health commissioners to get their act together. And here we've got the CBO predicting we lose 14 million people with insurance next year. And there's not even any changes next year. That's why we certainly disagree with that. We do know that...
Well, I guess the Congressional Budget Office did read the bill, because, yeah, there are changes, and approximately 14 million people are going to lose their health care. That is because of the Medicaid block granting coming down to the states. The states are not going to get the same amount of money that the federal government was putting into the Medicare program when it expanded it out. So the states are going to have to make a decision, and obviously they have budgets to balance, so their decision is going to be to knock people off of health care.
Premiums are going up under Obamacare. So in my district, right now there's a lot of misunderstanding about what it is we're doing. And once we get it done, and then we can have the chance to really explain it. And one of the biggest issues there...
See, and I love that. Once we get it done, then we can explain it. Why can't you explain it first and then get it done? If you explained it and the explanation works, then people will support you. But you're trying to ram this thing through, and your constituents, they're seeing all of the negative stuff. Obviously, the Democrats are pushing that. But if people can read for themselves, and, people can read, I hope, they can see a lot of the crap that's being proposed with this replacement plan. Now, specifically, when they get rid of the essential health care, which is another bone that they threw to those 50 guys, again, they don't want to cover emergency room visits. They don't want to cover pregnancies. They don't want to cover pediatric care, any type of maternity. They don't want to cover prescriptions. There were like 10 things they threw in there that, in my opinion, are the foundations for health insurance. And they wanted to pull all of that out of there. So this guy's living in a dream world, and I guess Donald Trump cast a hell of a spell. But now here's the fun part.
Not even talking about is we're eliminating $800 billion of taxes, fees, and penalties, which is going to boost the economy. This is like...
Right, okay, and that $800,000 in taxes, fees, and penalties, the lion's share of that is going to go to the 1% of the wealthiest people in the country. So they're going to get a giant tax break, and that tax break is going to be funded, obviously, on the backs of the middle class and poor people. But again, he doesn't really want to explain that. And anytime they tell you that when they cut taxes, it helps to boost the economy, it is true at a very, very low level, but the majority of the time when taxes are cut, the tax benefits are salted away, or they're given out as far as bonuses and other goodies to the upper management of the companies that are getting the most benefit from the breaks. So no, those tax breaks are not going to work their way and kickstart or generate a big push in the economy. That's just a straight out lie.
Step one of our tax reform, getting rid of these onerous taxes, fees, and penalties that have been a drag on our economy for 6 or 7 years. For some reason, I don't even hear that as part of the discussion.
Okay, and the taxes haven't been enforced for 6 or 7 years. The taxes have been enforced for 4 years, my friend. So you're embellishing a bit.
Of what we're accomplishing tomorrow.
Congressman, do you still have faith in Speaker Paul Ryan?
Yes, I do. Very, very difficult job, Brian. A New York Republican like myself, or I know Leonard Lance, who's coming on next, we're not the same as a Mississippi, Alabama, or Florida Republican. Some states expanded, like New York and New Jersey. New Jersey has a Republican governor. Ohio does, versus some of the southern states, the 19 that didn't expand. That's why this has been so difficult. The issues are not just as simple as people would say when you've got such a diverse country, and our conference represents that.
Yeah, and speaking of those 19 states, those governors, when they didn't take the Medicare expansion, they basically screwed all of the poor people, and they actually screwed a lot of the rural people, especially hospitals that would have benefited greatly from the expansion of Medicare as far as helping to pay for the costs of actually providing care to people, obviously, in the rural areas. But that's, why throw a few facts in there to confuse people?
Chris Collins from upstate New York, a yes vote among Republicans, and predicting tonight this thing passes tomorrow. We'll all be watching, Congressman.
Sure.
Thank you very much. And as you heard the Congressman preview, we also have Leonard Lance standing by to talk to us, a Republican from New Jersey who plans on voting no on the health care bill. Congressman, can you confirm that it was Bannon and Mulvaney, the budget director, who came in and announced to the Republican caucus tonight they wanted an up or down vote tomorrow, one and done?
I was not in the conference at that time. I had stepped out to do a television interview, but it's my understanding that there were officials from the White House in the conference earlier this evening.
Now, you have the most interesting congressional district. It starts near the urban core of the New York City area in New Jersey, and then expands as it heads west into what we New Jerseyans affectionately call horsey country out near Bedminster. It gives you a huge, diverse constituency. You're convinced that if they could all speak...
Want reform, but this is not the reform they want, and I think we can do better. And Brian, I'd like to go to phase 3, as it is called, right away. Legislation is saying that we can purchase policies across state lines, tort reform. I think these are essential components, and I would like to do those aspects first.
I asked Congressman Collins about Speaker Ryan because we're already detecting hints in some of the GOP messaging that are coming out anti-Ryan, perhaps already trying to pin the blame on him for this. What is your level of confidence in your speaker?
I have excellent confidence in Speaker Ryan. I think he's doing a superb job. I think he wants reform. I want reform. My friend Chris Collins wants reform, as does the President of the United States. The debate really on our side of the aisle is how to bring about that reform. And Brian, I would urge our Democratic colleagues to join us at the table. They've not done that so far. Obamacare certainly needs major repair. And
let me stop him right there. He would urge his Democratic colleagues to join them at the table. Well, your Democratic colleagues were asking you to join them at the table for like the past 6 years, but all you guys could say was no. So now all of a sudden, when the shoe's on the other foot, you guys have passed 50 separate bills to repeal Obamacare. For the last 2 years, both you and the Senate have passed bills to repeal Obamacare, and Obama has done you a favor and vetoed the bill. But let me ask you this question. For the past 6 years, you guys have been trying to get rid of Obamacare, and you've been telling us that you have a plan that is much better than the Affordable Care Act. 6 years you've had to develop this plan. And now all of a sudden, you guys throw something together in like 30 days and want to ram it down the people's throats and try to call it the best thing since sliced bread. That is a bunch of crap. And you guys are caught up, and you're going to be hoisted on your own petards, because if you don't repeal and replace the Affordable Care Act, people are going to call you guys liars. And if you do repeal and replace the Affordable Care Act with that crap that you guys have thrown together, people are still going to call you liars, because you said, or Trump said, and you guys parroted everything that he said, that your plan was going to be better, it was going to drive premiums down, and it was going to cover a lot more people. And the Congressional Budget Office basically is calling you guys liars. So either way, you guys are going to be labeled as liars. Now, in my opinion, the best thing you guys can do in order to avoid embarrassment is to vote that thing down, or don't even bring it to the floor for a vote. But we already know that Donald Trump has whistled for his puppy dog, Paul Ryan, and told him that a vote must take place tomorrow. So there's going to be an embarrassment there. But what would be even worse is that if you guys happen to pass that bill in the House, it is dead on arrival in the Senate. Dead, period. The Senate has told you that, and you guys are going to fall on your swords for Donald Trump and basically get no benefits. But, you know, stupidity must run in the on the Republican side of the aisle.
The exchanges are failing. In 1/3 of the counties in this country, there is only one provider of insurance, and that is simply unacceptable.
Now, on that, he's right, okay? But see, that's when Donald Trump should have called in the insurance companies and put his foot up their asses and told Aetna, United Healthcare, Humana, and I think there's one more that all of a sudden decided to exit various markets. In the case of Aetna and Humana, I believe, it's because the government wouldn't allow them to merge. So they exited all but 4 states as far as providing health insurance is concerned. But the funny thing about it was they were in approximately, I want to say 30 states, and they were looking at getting into another 15 before they got turned down on that merger deal. So if Mr. Trump wanted to practice his art of the deal skills, he should have pulled them in there and told them that they needed to get their butts back into those markets, or there was going to be hell to pay.
New Jersey had 5, we now have 2, and so I certainly agree with Speaker Ryan, with Congressman Collins, and with the President of the United States that we need to enact reform, and I hope we're able to do it. But we will need bipartisan cooperation, and Brian, the Democrats should come to the table.
You're a red district in a blue state. Are you at all affected by what's been repeated as either a jovial threat or a straight-up threat from President Trump that this would be remembered in 2 years?
I represent a district that is diverse. By a couple thousand votes, Hillary Clinton carried the district. Donald Trump was competitive in the district. He certainly knows New Jersey well. I had the honor of being in the Oval Office 2 days ago, and the president was willing to listen to us. And I thought that he heard our concerns, and I think 2017, Brian, should be a year of governance and not of politics. There'll be federal elections in 2018, but I'm concentrating on governance in 2017.
Before you go, can I get a prediction? Does this go up or down tomorrow?
I'm not on the whip team. I do not know, and I think each of us will vote his or her conscience.
Congressman Leonard Lance, Republican of New Jersey. Thank you, Congressman, very much for making time for us tonight.
All right, well, he's not going to have too much trouble defending his particular vote, especially since it's a no. So we will see, but tomorrow's going to be a pretty busy day.